Come back to side.
Hi, Tisay.
Hi, ma'am. Sorry lang.
Okay lang. As long as nakahabol ka.
Salamat po.
May date siguro si Tisay.
Wala.
So, okay, Teresa, we are just talking about the vital signs and we are already in the pulse rate. So, it is a little bit confusing now because we are going into more actual. So, we are talking about now the theory or the other side of the taking it as in actual. So, we are already in the pulse rate. Okay, so we were talking about how to take the pulse rate in full minute, if it is 60 seconds, and if it is 15 seconds, you will just multiply it by 4, or doubling it or taking it in 30 seconds, multiply it by 2 to have the measurement of 1 minute pulse. This is how the radial pulse is. As I mentioned before, so this is how the proper way of your 2 fingers on the pulse, okay, on the radial pulse. This is the radial pulse. So as we talk about, we have done it, the radial pulse. So this is only the repetition of the radial pulse that we had. So the same way, you feel the radial pulse first, and on the clock of when the second hand is on the clock, on the watch, so you start counting in 1 minute. Okay? So this is the radial pulse, and it is the most common pulse rate that is taken. Carotid pulse, we are not checking how many in the carotid pulse, but in such situation that the patient is too critical, so we are checking the carotid pulse because this is the only one that has, the strong pulse rate that you can take when someone is about to die or when someone has a heart problem. So the same way, you will put your 2 fingers on the carotid pulse and start counting the same. 60 seconds for 1 minute, 15 seconds multiplied by 4, and 30 seconds multiplied by 2. So pedal pulse is the same way. So you have to locate first where is the pedal pulse site. Once you feel it, so start counting the same way. In 1 minute, you start with 1 to 1 minute or 15 multiplied by 4 and doubling it to multiply by 2. Same with the brachial pulse, but when you are going to use the brachial pulse for taking the blood pressure, you have to use either your 2 fingers or a stethoscope. Okay? So the same way, the same process, we will start by locating where is the pulse. And once you feel the pulse, you will start counting with the second hand in full 1 minute. Heart rate. The number of heartbeats per unit of time usually is per minute. So all of the heart rate, all of the pulse rate is measured by 1 minute. Okay? So together with our body temperature, it is measured by 1 minute. But most of them, they have already in the digital a certain beep. It beeps within 15 seconds. It depends. Okay, so you will wait for the beep. So for taking the heart rate, you will use this stethoscope. So the heart rate is based on the number of contractions of the ventricles, the lower chamber of the heart. So the heart rate may be too fast. We are calling it tachycardia. That's the medical term. That is fast heart rate, tachycardia. Or the too slow, brady means slow, and cardia means heart. So the slow of heart rate, bradycardia. So resting heart rate is the heart pumping the lowest amount of blood you need because you are not exercising. When you are resting, it is called resting heart rate. So if you are sitting or if you are lying, if you are calm, relaxed, and are not ill, your heart rate is normally between 60 to 100 beats per minute. Okay, so that is the normal heart rate or the normal pulse rate, 60 to 100 beats per minute. So, but the heart rate lower than 60 doesn't necessarily signal a medical problem. Okay, sometimes those with the 60 or below the 60, it could be the result of taking a drug such as beta blocker. Some of those patients with the heart problem, so they are prescribed or the doctor has ordered them medication to take to make the heart to relax or to make it slowly to beat in a slow manner. So a lower heart rate is also common for a people who got a lot of physical activity, as I told you before. It was the athletes or those persons who are very athletic, they have the heart rate of as low as 40 beats per minute. So a low or moderate amount of physical activity doesn't usually change the resting pulse rate. So this is the table. As you can see, on the left side is about the various age group. So in the middle, it is estimated maximum heart rate. And the last group and the last column is about the target heart rate. For example, if you are 30 years old, your estimated maximum heart rate is about 190. But the target heart rate is only 114 to 162. Okay? So there is, a table that you can just refer, whether it is in your age, according to your age, according to how much the maximum heart rate, and how much the target heart rate should be. So this is just a table of reference. So going to the respiration rate. When talking about respiration rate, it is the number of breath a person takes per minute. This is how you breathe, okay? So it is usually measured when a person is at rest and simply involves counting the number of breaths for 1 minute by counting how many times the chest rises and the chest falls. Okay, so we want to count now the respiration rate, the breathing rate. Okay, so how are we going to do it? So we are going to do it in a count of 1 in the full 1 minute by observing the chest rise and fall. Okay, when the chest rise and fall, count as 1. Don't wait for the chest rise, 1, chest fall, 1. Okay, so you feel it, you try to breathe. Okay, so your chest will rise when you are breathing in, and when you are exhaling, it will fall, right? You just try it. So when you inhale the air, you will breathe in 1, and out 1. Okay? So in the count of rise and fall, you count only once. You will not count in the rise 1, in the fall 1. So count only once. Rise and fall 1. Rise and fall 2. Okay? So the respiration rate, it counts only, the respiration rate is usually measured when a person is at rest and simply involves the counting number of breaths for 1 minute by counting how many the chest rises and fall. Okay, so the respiration rate changes when fever, when you are ill, when you are sick, when you have medical condition, and when you are having different activities. So when checking respiration, it is important to also note whether a person has difficulty of breathing. So whenever you check the respiration rate, you will ask the patient first to take a relax. You will instruct the patient to relax first. Okay, and ask them whether is there any difficulty of breathing, is there any problem for the heart, is there any problem for the breathing, so you will know exactly, you will compare whether you will be taking it right, or you will be taking it high, or you will be taking it low. So the normal respiration rates for an adult person at rest ranges from 12 to 16 breaths per minute. Okay? So once you try to measure the respiration rate, you will be checking the same, counting for 1 minute, 1 full minute. So So how to measure the respiration rate? So to determine whether a person's respiratory rate is normal, so it is essential to measure it at rest. So especially when the patient comes into your medical center or into your healthcare facility, so you will instruct the patient first to rest, to relax. Okay? Remember, if there is exercise or even walking across a room can affect a person's respiratory rate. Means to say it's going to be high or it's going to be low. So how to measure it? To take an accurate measurement, watch the person's chest rise and fall. 1. When you check the respiration or the person's chest rise and fall, count it as 1. 1 complete breath comprises 1 inhalation, inhale when the chest rises, followed by 1 exhalation when you exhale, that is the chest fall. Okay, you got it? Respiration count, you check it or you measure it only in counting as 1 when the chest rises and fall. Okay, so to measure the respiratory rate, count the number of breaths for an entire 1 minute, or again, count it 30 seconds, multiply by 2, or count it 15 seconds, multiply by 4. The same. It will come a total of 1 minute. Got it? So that is the respiration rate. We go with the blood pressure. What is a blood pressure? So blood pressure is the force of the blood pushing against the artery walls during the contraction and relaxation of the heart. So each time the heart beats, it pumps blood into the arteries, resulting in the highest blood pressure as the heart contracts. Okay, when the heart relaxes, the blood pressure falls. So we have two numbers that we need to record and when measuring blood pressure. You have to remember that in blood pressure taking, we have two numbers. The higher number, which we call it systolic pressure or the systole, it refers to the pressure inside the artery when the heart contracts and pumps blood through the body. Okay? So number one number is the higher number. We called it the systolic pressure. So it is the first loud sound that you will hear when taking blood pressure. The second number is the lower number or the diastolic pressure. So it is the pressure inside the artery wall when the heart is at rest and is feeling the blood. It is relaxed. So the systolic and diastolic pressure are recorded as millimeters of mercury. So we do have two numbers in taking blood pressure. You have to remember, number one is the first loud sound. That's the highest number. The higher number, which is the systolic pressure. And the lower pressure, the lower number, the last number heard, that is the diastolic pressure. So the recording represents how high the mercury column in the old-fashioned manual blood pressure device called a mercury manometer or the sphygmomanometer that is considered as the aneroid. We have the aneroid now that you are going to use in the practice. So it is raised by the pressure of the blood. So today, nowadays, we have the aneroid, which the doctor prefers to use it because they said it gives a normal blood pressure measurement. While we have the other digital blood pressure monitoring machine. Okay, so when taking the blood pressure, the high blood pressure, or we call it hypertension. Okay, so when there is a high blood pressure, we call it hypertension. It is directly increases the risk of the heart attack, the heart failure, and the stroke. So another medical term in here is hypertension. Okay, so in hypertension, it increases the risk of heart attack, heart failure, and the stroke. So when anybody has hypertension or high, the higher above the normal, and the tension which goes with the blood pressure measurement, it is the hypertension. It directly increases the risk of the heart attack, the heart failure, and the stroke. With the high blood pressure, the arteries may have an increased resistance against the flow of the blood, causing the heart to pump harder to circulate the blood. Okay, so that is the high blood pressure. So talking about the blood pressure is categorized as normal when it is 120/80, or elevated, or stage 1 or stage 2 high blood pressure. So the normal blood pressure, which is the systolic of less than 120 and diastolic of less than 80. So elevated, that is the normal blood pressure, 120/80. Elevated blood pressure is systolic of 120 to 129 and diastolic of less than 80. The stage 1 high blood pressure is systolic is 130 to 139 or diastolic of between 80 to 89. The stage 2 high blood pressure is when systolic is 140 or higher, or the diastolic is 90 or higher. So in this kind of different types of hypertension, you will know, you will compare whether it is more than of the normal 120 over 80. So if it is more than 120 over 180, you will be checking on whether it is elevated blood pressure, it is stage 1 hypertension, or the stage 2 hypertension. These numbers should be used as guide only. A single blood pressure measurement that is higher than the normal is not necessarily an indication of the problem. Why? If you happen to come to a healthcare facility, you are sitting there and you wanted to see a doctor for something else. So definitely the nursing aide or the nursing assistant is going to take a blood pressure on you. And the first time that the nursing aide is going to take the blood pressure, and it happens to be on high level. So elevated hypertension, elevated blood pressure. So you don't be alarmed in the first time. Take the patient, get the patient to be rested or relaxed in 5 minutes and repeat it. So this is the proper way to take the blood pressure of a patient. You have to need to compare. Okay? It is not like the first time. Maybe she is in a hurry. She just came to you and you will take the blood pressure. She was running. So any activity might increase, might rise, or lower the blood pressure. Okay? So what are the equipments that we need to use when taking the blood pressure? We have number 1, you have the monitoring blood pressure right now? You have with you at home? Okay. So start using it, practicing it, according to the step-by-step that we will come in the theory. Okay? So try to listen with your stethoscope. Okay? And we will know, we will just compare what you have taken from your home. Okay? So aneroid monitor, this is the blood pressure which you are having right now. So there is a dial gauge and it's read by looking at the pointer. There is that round thing that is the dial gauge, okay? That has a pointer. So the aneroid monitor is less expensive than the digital monitor. Why? Because the digital is more expensive nowadays because there is no need for you to pump the cup, okay? So here, but aneroid monitor is the most prepared by the doctor because according to the doctor, this one gives them an accurate blood pressure measurement. So the cup is inflated by the hand by squeezing a rubber bulb. Did you see your blood pressure monitor? There is a rubber bulb. So this one, you have to compress it. You have to squeeze. Okay, some units even have a special feature to make it easier for the cup to cup on with one hand. However, the unit can be easily damaged and becomes less accurate. So the person using it must listen for the heartbeats with the use of stethoscope. So it may not be appropriate for the hearing impaired. Okay, so if you have the hearing impaired, if you have something with your ear, it is difficult for you to hear an accurate blood pressure measurement. So digital monitor. The blood pressure reading flashes on a small screen. It can be used to measure blood pressure. So no need for you to pump. Just put on the button and it will automatically read the blood pressure. But according to this is an automatic one and it is an expensive one. It measures, the measurement will just come out in this small screen. So because the recordings are very easy to read, this is the most popular blood pressure monitoring nowadays. It is also easier to use than the aneroid. Why? Because there is no need for you to use the stethoscope. And there is no need for you to pop, to squeeze the uh, um, the monitor cuff, the monitor bulb. Okay? So one disadvantage is that when the patient moves, when the body moves, or when anything, like if you jog or if you just, like you just bump to the patient while taking the monitoring, the blood pressure monitor, it will give you an inaccurate, irregular heart rate, or the blood pressure monitor will not be accurate. Okay? So that's why the doctors, they preferred more on the aneroid monitoring blood pressure machine. Number 3, we have the wrist digital blood pressure monitor. The wrist blood pressure monitor, they are not as accurate as measuring the blood pressure as the other types of monitors. But according to the reference, as long as your battery is okay, as long as your battery is strong, so it will give you an accurate blood pressure monitoring. So in addition, they are more expensive than the other monitors. Stethoscope. Reading blood pressure by the use of stethoscope by auscultation is considered the gold standard by the Heart, Lung, and Blood Institute. Why? Because, listening by the use of the stethoscope, when ausculting the heartbeat, it is according to the Lung and Blood, the Heart and Lung Blood Institute, they are the gold standard. Means to say, this is the most reliable if you are going to use the stethoscope in taking your blood pressure and and by the use of auscultation. So the blood pressure measurement procedure. This is what I'm going to ask you to try to do it at home. Since you have already your blood pressure monitoring aneroid, right? So you follow these steps. When we come to our actual, you will come to know that it will be a little easy. But what I'm going to remind you is, take it accordingly. So according to the procedure, do it accordingly. So number 1, what are the steps to take the accurate blood pressure measurement? Number 1 is to choose the appropriate and right equipment. What does it mean? So number 1, your stethoscope must be a quality-wise, a quality stethoscope to be used in taking the blood pressure. Number 2, an appropriately sized blood pressure cuff. Okay? So in the babies, in the infants, in adults, or those patients who are really big enough, you need to appropriately choose your blood pressure cuff. It is not always that you can use this blood pressure cuff. When the person is pediatric or a baby, you need to use a pediatric cuff. If it is neonates or if it is a baby, you use a neonate cuff. When you are normal, you can use this cup that you have right now. But if you are a little bit obese, a little bit big person, so you need an oversized cup. Okay? Because it will not give you a proper, accurate reading when you are not using your appropriate BP cup. So a blood pressure measurement instrument such as aneroid or digital automated device with a manual inflated mode. So that is the same as your aneroid. So number 2, prepare the patient. How we are going to prepare the patient? when you are having a patient. So number one, choose your appropriate equipment. Number two, prepare the patient. So how are we going to prepare the patient before taking the blood pressure measurement? So you have to instruct the patient to take at least to relax 5 minutes before you take the first reading. Because accordingly, you know, like for example, the patient is in a hurry and you need to take blood pressure right now. So you will be taking either a high blood pressure measurement or inaccurate pressure measurement reading. So number two, you have to ask the patient to sit upright with their upper arm positioned in the level with their heart and their feet flat on the floor. So you have to ask the patient, kindly sit properly with your hand put on the table. It should be in the level with the heart. So with your feet flat on the floor. Number three, remove the excess clothing that might interfere with the blood pressure cuff or constrict blood flow in the arm. Number four, be sure you and the patient don't talk. Refrain from talking during the reading. Why? Because when you are talking, so the patient will answer. So the blood pressure measurement will not be accurate enough. Number three, choose the proper blood pressure cuff size. So most measurement errors occurs by not taking the time to choose the proper cup size. Means to say, if you are in a hurry, if you have something, if you are too busy, you are just using any cup that you are seeing that is attached to that aneroid. Okay, so number three rule, you have to choose the proper blood pressure cup size. Okay, so wrap it around in the patient's arm. Use your index finger or the index line or two of this middle or the index finger to determine under. You have to put it under the cup. Okay, so you will know the circumference falls within the range area. So there is a space for the BP cup to inflate. Otherwise, you choose the appropriate smaller or larger cup. Number four procedure, place the blood pressure cup on the patient's arm. So palpate. Okay, so once you already put the blood pressure cuff on the patient's arm, you have to palpate now. Locate now your brachial artery and position the BP cup so that the artery marker points to the brachial artery. So wrap the BP cup snugly around the arm. Okay? So as we said, the brachial artery is used for taking the blood pressure. So number five is position the stethoscope. So when taking the blood pressure, if you are using the aneroid blood pressure monitoring machine, you have to use the stethoscope. So on the same arm, you place the BP cup, palpate the arm onto the antecubital fossa, that is where the brachial pulse is the strong sounds comes from, and place the bell of the stethoscope over the brachial artery in this location. Okay now? So now we have already put the cuff and we have already feel the brachial pulse. So we will start now how to read the blood pressure. Number six is to inflate the BP cup. How to inflate the BP cup? With your stethoscope, with your hand, with your thumb on the stethoscope bell. Now on your right hand, you have to inflate, grab the black squeezing rubber and start pumping the calf bulb as you listen to the pulse sounds. You must be sure that your stethoscope, you are listening or hearing the brachial pulse when pumping for your BP cup. When the BP cup has inflated enough to stop the blood flow, you should hear no sounds through the stethoscope. But the gauge should read 30 to 40 millimeter per mercury above the person's normal BP reading. So when the patient sits, you have to ask them, okay, is your blood pressure normal? You have hypertension, or you have any condition with the with the high blood pressure, at least we know what to compare, or at least we know how high we are going to raise the cuff, the gauge. Okay, if it is 180, you have to raise at least 30 to 40 more. Okay? So if this value is unknown, you can inflate now. You start to inflate to 160 over 80. Like for example, you ask the patient, how much is your blood pressure last time, ma'am? So the patient will answer you, it is 140 over 90. So now, you will increase, you will inflate the cup to 160 or up to 180. Then you will feel, you will hear now from the stethoscope, when you deflate it, you will hear the first loud sound. 7. Once slowly deflating the blood pressure cup, as soon as you deflate it gently. The American Heart Association recommends that the pressure you should fall at 2 to 3 millimeter per mercury per second. Anything faster may likely result in an accurate measurement. Imagine that. By inflating, by deflating, if it is not proper, you will take an inaccurate blood pressure measurement. So it's very difficult, right? So number 8, listen for the systolic reading. So what is the systolic reading? It is the first loud sound that you will hear once you deflate the BP cuff. Okay? So it is the first loud sound. So this may resemble the tapping noise at first. Something like something there is a sound. You can hear it only once we are in that position. Okay? So the first loud sound is the systolic pressure. So number 9, listen for the diastolic reading. We already know the high. The first loud sound, we already got it. Okay? So now, while deflating slowly, you will hear the last loud sound, last. So when you continue to deflate the BP cup, it will be gently deflating. And the last sound that you will hear, that is the diastolic reading. That is the second number in the blood pressure.